Constitution, Your Excellency, provides that the Speaker of the House that originated the bill presents it to the President for assent after passage by the last House. This is a final copy of the Digital Health Agency Bill. It's also slightly over 60 clauses, Your Excellency.
Your Excellency, I now invite you to affix the public seal of the Republic of Kenya on the statutes. Sir, I now invite you to display the ceremonial copy of the Act and thereafter to hand one set of the Act to the Attorney General for publication into law. You can also hand over the other two. Governor. Yeah. I thank you, Excellency. Permit me now to invite the Cabinet Secretary for health to make a few remarks and to thereafter progress the programs, today's programs. The Cabinet Secretary for health. Pardon? You can have your seat, sorry.
Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, the Deputy President, Honorable Rigathi Gachagua, Speakers of both Houses, Governors present, my colleague, Cabinet Secretaries present, PSS present, senior government officials present. Your Excellency, today is indeed a great day, not just for Nahumicha, the daughter from Sehendu, but for the whole Ministry of Health. Before I make a few remarks, Your Excellency, permit me to invite some of the stakeholders that have been with us on this journey to come and make a few remarks. I'll begin with the Majority Leader of the National Assembly, Honorable Kimani Ichung'wah.
Thank you, Waziri. Your Excellency, the President, Deputy President, all protocols observed. Your Excellency, the President, I'm honored this afternoon to join you in the assent of those 4 health-related bills. Your Excellency, you will recall that during the campaigns last year and in the run-up to the campaigns, you did promise the people of Kenya radical changes in our healthcare architecture of the country to actualize the universal health coverage dream that has faltered in the governance of our country over the last close to 15 or so years. Your Excellency, your assent to these 4 bills today makes that dream become a reality in the very near future. And we look forward to the implementation of these bills by the Ministry of Health and all the stakeholders that will be involved in the implementation of the 4 bills. Your Excellency, the radical changes in our healthcare architecture will see not just the realization of universal healthcare coverage for millions of our people, but you bring to an end the rendering to destitution of millions or hundreds of thousands of families across the length and breadth of the country. Families that have been rendered homeless, others, Your Excellency, have lost many of their assets on account of healthcare bills. The Social Health Insurance Fund Bill, Your Excellency, will in a big way transform the social health insurance subsector of our country and assure Kenyans that they shall no longer have to lose their homes, they shall no longer be rendered homeless or become destitute in their own country on account of healthcare bills that they have incurred in hospitals. Your Excellency, the Digital Health Bill leverages in a great way on how we leverage on technology to improve the efficient and effective provision of healthcare services from the far-flung corners of our country to the level 5, level 6 referral hospitals in our country. It will be possible now, Your Excellency, in due time for Kenyans to be able to have a CT scan in Elwak and have a medical consultant in Kenyatta National Hospital or Nairobi Hospital review that CT scan and be able to advise the healthcare professional back at the health center in Elwak on how to treat their patients. It is this revolutionary interventions, Your Excellency, through a very participative process that began with the Ministry of Health, and I must commend the Ministry of Health for the very detailed and participatory approach they began almost a year ago when your administration came in power. To date, Honorable, Your Excellency, my apologies, I'm used to addressing the Honorable Speaker. Your Excellency, culminating to the assent of these 4 bills today, that participatory approach, Your Excellency, culminated in what has also now anchored a new way of working between the 2 houses of Parliament, and I'm glad to inform Your Excellency that the bicameral Parliament has worked very well together, both houses, the Senate and the National Assembly. And we saw the passage of these bills in both houses. The bills that originated from the National Assembly were passed in the Senate without a single amendment, and those that emanated from the Senate were passed in the National Assembly without a single amendment, through a process where the 2 houses, both committees of health in the 2 houses, were able to consult ahead of the passage of the bills and agreed on the nature and manner of amendments that they wanted passed, and they were done in each house. And Your Excellency, I believe this also lays a very firm foundation on better working systems and processes of the bicameral Parliament in our country. With those few remarks, Your Excellency, congratulations, and I do hope, Your Excellency, that you shall lead your administration in actualizing this dream of universal health coverage to the people of Kenya. Thank you, Your Excellency.
Your Excellency, permit me now to call the Leader of Majority from the Senate. I'm told he's not around. He'll be represented by the Chief Whip.
Mr. President, sir, all protocols established, it is my pleasure on behalf of the Senate, elected and nominated members of Parliament, to bring their greetings and to bring their congratulations to the President and all the stakeholders, including the families back home that will be partaking of this bill. Your Excellency, allow me, as I congratulate you, to also pass my congratulations to the leader of the minority in the Senate, because on this series of bills, it is an area where we agreed to agree on everything, including some of the amendments we eventually made. Allow me, Mr. President, to also thank members of the National Assembly because they accepted all the bills that originated from the Senate without any amendments. Mr. President, sir, allow me also to thank the Minister and her permanent secretaries for the support that they gave us when we were debating these bills. Finally, but not least, Your Excellency, let it be on record that where the Senate debated these bills from was actually where primary health is truly required. We did the debate from Lodwar, the headquarters of the county government of Lodwar. The county government of Turkana. We were well received by the governor plus the entire county assembly, and we owe them. Mr. President, sir, members of the Senate debated late into the night because they wanted to make this enterprise even better. Your Excellency, as a professional of medicine, I want to confirm that you are truly going to be remembered in this country for what you have done, because it is lack of primary health attention to the concerns of patients that eventually leads to the loss of unnecessary lives. Mr. President, the innovation of the digital health bill is going to save millions upon millions of Kenyans, because many mothers, some of them, have no idea what the doctor said 6 months ago when the child presented to them. And when they have to restart the story, they lose out on very important information. But with the digital innovation, this will no longer be necessary. And remembering that some of our mothers do not have the standard of education required, and Mr. President, remembering that some of the mothers also live with disabilities, including the disability of inability to talk, the disability of inability to hear, Mr. President, this indeed is the time for this legislation. I thank you and I congratulate you. Uriomno.
Your Excellency, in the development of the bills, we worked with very many development partners. Those who supported us in drafting, supported us in developing the standards that eventually went into the bills. There are many of them that I cannot be able to mention each one of them. But on behalf of all of them, I would like to invite the WHO country representative, Dr. Abduramin Diallo, to come and make a few remarks.
Your Excellency, Mr. President, Your Excellency, the Deputy President, please allow me to stand on the protocol already established. It is a great honor for me to be here today representing WHO and representing all the development partners to witness this historical moment of signing these very important health bills. Mr. President, little less than 10 years ago, I was called back in my country of origin, Guinea, to serve as Minister of Health to help bring to an end the worst disease outbreak in that sub-region of West Africa, the Ebola disease outbreak that started in Guinea, spread to Liberia and Sierra Leone. It was very severe. It was bad simply because the health system was not resilient in all its components. In terms of surveillance, the surveillance system was not ready at all, and we all know the importance of community-based surveillance, the ability to detect unusual events happening within communities, recording that, and transmitting that. The infrastructure was not appropriate. Human resources were not adequate in terms of quality and quantity. Diagnostics was not where it needed to be. In fact, the diagnosis was confirmed in Lyon, in France, not even in Guinea, not even in Africa. The supply chain was not where it needed to be. Your Excellency, I'm bringing those up simply to say that by signing these bills today, you enable the health system in Kenya to be resilient and ready for those challenges. It was bad. 33 out of our 38 districts were hit with 67% mortality rate. We lost 115 healthcare workers to Ebola. Again, you enable the health system today to be resilient and ready for such challenges. And I would like to congratulate you on behalf of all partners. Your Excellency, I'm not going to deliver a speech. I just want to say one simple word about the fact that you bringing health to the communities, wherever they are, whoever they are, ensuring equity here and leaving no one behind. And those bills are in alignment with the Sustainable Development Goals, specifically SDG 3. And in terms of process, you've made it very clear consistently that health is a priority of your political agenda. And that message has consistently been conveyed by the Cabinet Secretary, Susan Nakumicha, her principal secretaries, the Director General, and technical services. In terms of inclusion, us as development partners were always invited, we were consulted, we were at the table, so we were part and piece of this whole process, and we would like to thank your services, the department, for that inclusion, for that great partnership. Beyond that, we also witnessed that other departments were invited. Every time the Ministry of Health is organizing an event, other departments are invited. That ensures synergy, complementarity, and cohesion in the governmental action because health is at the center of development. So I would like, on behalf of WHO and once again all development partners, to congratulate you and assure you that we will be by your side. You ring, we will answer. Thank you very much.
Your Excellency, the implementation of primary health care lies in the hands of the county governments. Permit me to invite the Chair of the Council of Governors. I'm aware that she's not in, but she'll be ably represented by the Chair of the Health Committee in the Council of Governors, Honorable Mudomi Njuki, the Governor of Tharaka Nithi County.
Your Excellency, the President of the Republic of Kenya, the Deputy President, and all protocols observed, ladies and gentlemen, Your Excellency, allow me first, before I make my remarks, to confirm to you that the Council of Governors is fully represented here, and you are part and parcel of this journey. I am accompanied by the Governor for Kakamega, who is also Chair for Finance. We are also accompanied by the Governor of Narok, and the COG Secretariat who are within us. Your Excellency, also allow me to thank you on behalf of the Council of Governors. You know, we are not used to bills being signed in broad daylight, in public, in glare of the public like this. We don't want to say the word, mostly they were being signed. And that is why you saw that when I came here first, I walked back and I went to the bill because we are not used to these things. Apologies for that. Your Excellency, when we met in Naivasha for the summit, you are very clear in your mind to the governors that UHC must be implemented around this time. And this time round we should not fail because it has failed 3 times. And Your Excellency, today we are happy to be here today to witness and congratulate you for the record speed at which you have achieved what we thought would be achieved in several years, has been achieved in just several months. On 17th of September, we were convened by the Cabinet Secretary for Health as Council of Governors to be taken through what would be contained in the 4 bills. And I confirm, and you're aware, that we raised a few issues. There was a bit of noise, but that is normal, Your Excellency, because when you're constructing a house, at the beginning, there's usually a lot of noise of several tools being used. But when it comes to the launching of the complete projects, it is usually merry and happiness, like you're witnessing today. I want to confirm that we formed a technical committee composed of both the Minister of Health and Council of Governors that looked at all the issues. And I'm here today to confirm on behalf of the Council of Governors that 95% of the issues were addressed, and therefore we are contented because 100% would be a bit abnormal. Your Excellency, of the 4 bills, we have no issues completely with the 2 bills, and that is the digital health bill and the primary care health bill. The other 2 bills, we will not say exactly we have issues. We only ask that in the state they are in at the moment, they may not be implementable, but the solution would be to have regulations made in the shortest time possible so that we can make them implementable in a better state. And I'm sure with all the speakers here and the leader of majorities, that is going to be achievable within the shortest time possible. I want to thank you on behalf of the Council of Governors for making it possible for our wananchi who have been dying under the burden of the bills that are usually in every village in Kenya, raising money for bills, for medical bills. It is now going to be a thing of the past because the social health insurance bill has ensured that we will have more contribution by all Kenyans, because I don't see, even in the village, one who will not be willing to contribute 300 shillings just to secure the future of the family. We want to thank you most sincerely for that. And lastly, like the Chief Whip has put, one of the biggest killers or health hazards in Kenya is not really mistreatment, but it's usually misdiagnosis. And that happens because in our health space, at the primary level, right at the village, all patients normally have a piece of paper they normally call Kitabu Hospitali. It is usually very expensive in the village. They can't afford the whole exercise book. So they usually cut it into half or quarter, and they carry that as a medical record, and it's kept like a very valuable document. But Your Excellency, people can lose IDs and passports. What is a medical record? So people always find their way back to the hospitals without that record. You're in a different county, you are treated in another different county, you have no records. And when you give the story again, you may be given the same drugs you were given 10 years ago, which failed. And as a patient, you may not be able to know. With the digital health bill, it will not be possible for the doctor treating a patient in a different county to be able to access those medical records from another county and do the right diagnosis. That will save a lot of lives and that is what the future holds for Kenyans. And we can't thank you enough for realizing that health is one very critical thing you'll have for your people above anything else. And I finish, Your Excellency. They say that when you want to kill a dog, you give it a bad name. We had a famous or infamous, I don't want to call it a project. It's more or less an arrangement that was not well, it did not have a lot of consultation, called the MES, which we dubbed as MES, senators know, which we later said it was a necessary evil because it is equipment we're used to at the moment. We are aware they may not be being conceived with a lot of consultation, but they are there with us and we can't do without them. Even as you put this together, Your Excellency, we ask you kindly to find it within your heart, not to abandon counties in this very hour of need, because they may not be able to afford the MES at the moment. Please just give it another name and roll it out to the counties so that we can save their lives. Thank you very much, and may God bless you, sir.
Thank you, Your Excellency. Now I would like to make a few remarks. Your Excellency, when you gave me the responsibility to take charge of the ministry and ensure that we implement universal health coverage, let me disclose that for a minute, I felt a little bit inadequate, despite having the health background. But I want to thank you, because besides me as your advisor, you also have your advisors in the Economic Council. And the secret of our success today, Your Excellency, is that I sat with your advisors in the Economic Council, and I told them, you know very well, I am the advisor to the President. Therefore, we can only make a team. Your Excellency, Dr. Mwai has made great contribution. Your Excellency, Dr. Thuranira has made a big contribution. Your Excellency, Dr. Leah has made a big contribution. Those are members who are your advisors in the Economic Council, but I made them and turned them into my own advisors, and we have been working as a team to deliver on the responsibility that you gave us. Your Excellency, when we sat down and we agreed that for us to deliver universal health coverage, we must learn from the past mistakes and see what is it that we need to do as a ministry to ensure that this time round it does not fail as per your instructions. Your Excellency, we came up with 4 main pillars. The pillar on human resource for health. And we have been working together with all stakeholders. And today I'm happy to see that all stakeholders, or majority of them, are represented here. Dr. Davji, karibu sana, and let's work together. Your Excellency, we are in discussion, and in Kapkatet yesterday, we made a health workforce Kericho declaration. And one of the things that we agreed, Your Excellency, is that in the next 24 months, we are going to have a harmonious working relationship with all the unions, so that we ensure that we deliver on universal health coverage. We have many other issues or clauses in the declaration, and we have given ourselves timelines, because each one of them must be achieved. The second pillar of universal health coverage is on health commodity security. We have made tremendous efforts towards progressing that. While we began with ensuring that we reform Kenya Medical Supplies Authority, and I can confirm to you, the board that we have, the leadership that we have is now on track. And last week on Friday, you yourself witnessed what the team has been able to do. Your Excellency, when we came into office, the fill rate for orders that have been requested by the county governments was at 40%. As we speak today, Your Excellency, I have received feedback from many counties that we are now headed to 70%. And that is how we are working, Your Excellency. We are focusing on local manufacturing.